Hello friends, welcome to course 401.18, Innovation in Regulated Industries. I'm your facilitator Jason Leopold. In this module, we'll share with you a case study that we developed as a part of as we were developing this course content. And the specific nature of this case study is in healthcare delivery industry. Let me share with you our experience and how you can be participating in these case studies in the future. So the subject of the case study was never events. Never events is an event that happens in hospitals that should not happen. For example, a mistake, a right information not being in the right place happens. As a result of that mistake, unnecessary consequences occur, which leads to often a longer stay in the hospital, unnecessary tests, and other complications. What we looked at in this industry in the past 20 years, in this specific event, never events in instance, there has just really not been any significant improvement. And recent studies also showed that there is really nothing significant that is coming forward in this industry. So we thought we should apply our skills. And subject of never events, we took the approach is that if we can reduce the probability of an error by providing the right information to the right person in the right context, and that person is motivated to use the information in the right way, our chances of reducing the probability are much higher. Since we knew how to do something about reducing the probability of an error, given our quality assurance and the safety initiatives and experience for the past 30 years, we thought this was the right place for us to start. And we also wanted to take a look at this as an event, as an innovation event in a regulated industry, where not only you can develop these capabilities for your internal improvement, but also apply these capabilities in broad terms. So that was kind of our context for creating this innovation program. So like others, we took our same 4-step learning methodology, identify the opportunity, identify the unique nugget, and create a minimum viable product, and figure out how will we integrate this unique product into a broader value chain and extend beyond the walls of our own organization. So given those 4 data points, next step was for us to create building blocks. Building blocks of solution, one building block at a time. So first we were told, since we have no experience in healthcare industry as a whole, we were told, and we learned from experience, that care providers are difficult to work with. So we set out to resolve that issue, work with the care providers, give them the solutions that they will use. So we created an information system that eventually at the end of the day, by the time we were done, we were having nearly 1,700 hospital providers within one institution using the system on a daily basis. And most important thing was it was all done voluntarily with very little directive from the senior management. People used the system because it worked for them. It helped them provide better care. So that was our building block 1. Next building block is that if you want to scale up, next thing you have in this industry as a perception is that bring evidence. Is there proof that this, what you're saying, actually improves something without unintended negative consequences? So we spent next several years publishing articles by fellows and residents and other healthcare providers. That took several years. As you know, that controlled studies take a long time to conduct, to evaluate, analyze, and publish. So next step for us was that once the evidence was there, then the question was asked and said, well, there is very little net new money in the hospitals. So therefore, the system has to be very cost effective. So we created an architecture that would have allowed a hospital to use the system less than a 1 pressure ulcer cost. If they can avoid 1 pressure ulcer per year, system will pay for itself. And the learning, we didn't want to have a disruption. We want to have a very incremental deployment. We developed the content in a way that an average provider who actually understand how a browser works could use the system, learn to use the system in less than 2 minutes. So we tackled the number third, cost and disruption challenge. The next question was, we said we need to build a community with the corporate social responsibility as a core of it. Because we wanted to create a never-event center of excellence that this group could study the issues, develop innovative solutions and systems, and provide those capabilities to globally and relatively next to no cost. So we had a reasonable amount of success on that. We had a structure and everything that was built in a place to actually take place. So that was the number fourth building block was addressed. Now this all took place over several years. Lastly, we got into a new challenge. In order to scale the system across the organizations, we needed help of administration services, healthcare practice leadership, and information technology. And this is where our hypothesis of developing a system of creating a never-event center of excellence had faltered. Our hypothesis was that if we build an innovative, user-friendly, useful systems, it will work itself. Not so. So as a result, after several years of working, we solved one problem at a time, and eventually we got to a problem where our direction that we have chosen was not going to work. So what we learned over the years, we learned is that it is not, improving healthcare delivery is not a funding issue. It's not about the money. It is not about a technology. And it certainly isn't about care providers. Care providers are more than anxious and willing to participate. And innovation in the medical industry happens at alarming rate. By no means us failing at this innovation program means that there is no innovation happening in medical industry. Medical industry is innovating at alarming rate. And all for good reason and for positive change for humanity. But we have a problem in the governance, how the management of healthcare delivery works. Our challenge was not so much medical science, our challenge was healthcare delivery management. So that is the challenge that we intend to solve next. So knowing full well that we can actually develop a technical solution that people will use. We know how to create one, and we can actually develop better ones as new technologies with the machine learning and artificial intelligence becomes more readily available. But we wanted to tackle next big challenge is governance. Ability to drive innovative change in healthcare delivery at digital speed. In order to address that, we needed to address a number of stakeholders. Stakeholders that we previously weren't part of our model. Administration, practice leadership, information technology. And by no means these people are in the way. It is not about an individual, it is a system. System created for these people is basically based on the assumption that is my effort plus my excuses are results. I am doing everything that I can, but the system wouldn't allow me to do it. That is where the defeatist attitude is in a healthcare delivery governance. And it's a political problem to solve. It's not an information technology. It is not a money problem. It is a people problem. And governance problem. We need to create a governance structure that allows healthcare administration to actually do what they are hired to do. So we intend to develop an innovative solution for that problem to solve. It is no longer an information technology widget problem. It is a governance problem. So how we intend to tackle this? Like any other system problem that you encounter, first you go back to your study of the value chain. Why do people behave the way they behave? If you wanted to do something different, change the behavior, change the incentive system, change the structure. Second thing, we look at healthcare delivery is a regulated industry. We need to have a fundamental understanding that there is no concept of a profit. Because in lack of profit, there's no incentive for leadership to innovate. All innovation models today exist for the incentive of profit. Profit leads to higher market share leads to higher market value, and hence the senior management compensation. We need to come up with a new innovation model, and hence the result of this course. We wanted to take a look at it, how we innovate in regulated industry where it is no profit concept. And we also wanted to make sure that model that we develop learns at a faster pace than the one that we had. We spent nearly 9 years coming to this far on this innovation solution so far. That just not feasible. We could have very easily have accomplished everything that we accomplished in 9 years within less than 3 years. So what's a good start? So our approach is, by no means this is the only approach and it's the right approach. We don't even know whether it's right or wrong, but we know it is a approach. So what we wanted to do is we wanted to create the right measures, the right incentive structure. So if we look at the business outcome that we want to achieve, we want to reduce the probability of a never events. And we want to have total business value of extended capabilities. The capabilities that we create to tackle the never events issue within the hospital, and how do we actually take those set of capabilities, create an ecosystem outside, beyond our own value chain. And we wanted to look at this thing. So in order to create those business outcomes happens because the right behavior happens. So we look at the capabilities performance. If we sort of turn it around, instead of creating a system that says everything is invented here, we actually create a structure that is broadly thinks about innovation. Number of innovations adopted from other organizations. You don't have to invent everything. Wheels don't have to be invented here every time. Number of innovations published, and then we helped other organizations to adopt them. Number of innovations that broadly deployed within the organization where they are created. So by no means this is a complete comprehensive list of capabilities performed. So we wanted to think differently. We wanted to think cooperatively in this spirit in this industry exist. And additional benefits, if we accomplish this thing, we can reduce barriers to adoption. Ability to create a culture of innovation. Enable people to be innovative in the profession they have chosen to be in. Healthcare providers are the most committed people that you would ever come across. In my 10 years and 9 years of working in this industry, I have never come across a healthcare provider who is not committed to what to their oath, to do no harm. And we can, as a result, can create new capabilities. So by no means this is the only way to approach this thing. We are open to all suggestions. If you are from the healthcare industry or any industry passionate about tackling this issue, reach us. Let's have a further discussion. How are you tackling this issue? There's no right solution. The only solution that is the right solution, the one that solves the problem. So we are committed to using our innovation methods and tackling the challenge of never events. And we will learn, we will improve our methods. We will hopefully address this issue. And our goal is to create a never events center of excellence. Now we have setbacks. We are starting from scratch. Once again, after 9 years. But we'll get there. There's lots of time. And I'm Jason Leopold. I'm the facilitator of this program. And I would love to hear from you, from your innovation journey. Share your experiences and share your story on this platform so others can learn from you and we can learn from each other. Once again, I want to thank you for your time. I look forward to hearing from you more. Bye-bye for now.